Now coming to the normal routine for a type 1 diabetic child. The first and foremost responsibility as a parent or as a teacher or as a guardian of a type 1 or even as a doctor of a type 1 diabetic patient is to educate the child about diabetes, why diabetes, what is the treatment of diabetes, what are the possible complications, what are the outcomes of having a good normal sugar values maintained, or if the sugar values keep fluctuating, what are the possible outcomes. Now once a child knows about the disease, the child is aware about the clinical scenario, the child himself or herself will volunteer to follow a good normal healthy routine. Now normal healthy routine doesn't mean you have to restrict your child from participating in sports, restrict your child in eating certain food items. No, it is about teaching your child what to eat, when to eat, how to eat, how much to exercise, how much to be a part of physical activity or sports, what other activities the child can participate in, how much important education is for the child. All these are very, very important for the child to know. If the child is very well educated about the food, what can be eaten, what cannot be eaten, the child will not get tempted when somebody else offers sweets or any other item which he should not be eating. The child will know how much of physical activity or which sport he should be participating in, and when the symptoms of hypoglycemia show, what is the first step he or she has to take. The child has to know that he should study well for his future, because the disease is limiting him or her from certain aspects of life, but it is not going to stop him or her from living a normal life later on. The child should know that other than sports, he can, like the outdoor sports, he can also show all interest in other sports like chess, carom, many other sports which does not need much of physical activity, but which will definitely take them to great heights otherwise. So it is in your hands whether you make the child or you break the child because he or she is suffering from diabetes. Encourage the child to get up early in the morning, go for a small jog or maybe a 10-20 minutes walk. Help him eat and choose right food in the right quantity. Encourage him to study well. Encourage him or her to participate in all the extracurricular activities which will not, knowing the limitations. This will make him or her to lead a normal life like any other child.